Tembisa Hospital has recorded a number of baby deaths. According to Gauteng Health and Wellness MEC Nomantunkomo Ralehoko, almost 800 babies died at the Tembisa Provincial Hospital in the past 3 years alone. Nkomo Ralehoko assured that problems with limited resources, such as a staffing and equipment shortfall at the facility, have been given first priority. Let's get reaction now from Denosa's Bongani Mazibuko. Thank you very much, Bongani, for your time here on eNCA. This obviously also speaks to the fight from unions and organizations such as yourselves about the ratio, the patient-doctor or patient-nurse ratio that is at a dire state in South Africa.
Yeah, good afternoon and thank you for having me. This is quite disheartening, almost 800 babies in 3 years. It doesn't matter how we look at it, but 800 is quite a lot of lives to be lost. And it's very disturbing, especially because if you look at it, we've been mentioning issues of shortage of staff and the issue of resources in the Department of Health for a number of years, and they're not getting adequate attention. So it seems like sometimes you wait until there's a disaster or people lose their lives, and then that is only when people start acting.
I mean, 237 babies in 1 year, and then 271 the following year, and 280 the following year. So it's just been going up for the past 3 years, and it's all because of infections.
Yeah, yeah, definitely. Infections and the shortage of staff. And you also have to bear in mind that because of the conditions of work that nurses are exposed to and the doctors, you find that you are losing brain drain. You are losing people who are experienced in those particular areas. ICU and neonatal areas, those are specialized areas. So if people are not able to be accommodated in a conducive environment, they are definitely going to leave and look for greener pastures. So if those things are not addressed as a matter of agency, then we might find ourselves in a position where we are losing more people, or people are, or nurses, or the patients are put at risk because of shortages of staff.
And some of the infections that have been mentioned in this particular case, or in these particular cases, is also infections that are caused by unclean areas, Mr. Mazibuko. So this also would, I know it would speak to the shortage of staff as well, and the patient-nurse ratio. But surely there should be something that is done about the cleanliness of an area, especially a hospital, and especially wards that look after mothers giving birth.
Yeah, definitely. What you find is that the ICU in itself, there is not enough time to be cleaning and so forth. A baby is in an incubator or in a cot, and immediately that baby leaves, then another baby is put in there. And so you would find that there's shortage of linen. And now you don't have a clean linen to put in that cot for the next baby to come in. So you find that now, because of that, there's a duplication of infections, because the next baby is exposed to the dirty linen that was used by a previous baby. So those are some of the things that you find that are predisposing the babies to those infections. And it's totally unacceptable, because these are things which can be preventable. To me, these are preventable deaths, because it also goes against the Millennium Goals by World Health Organization and even the ICA and International Council of Nursing. We have said that we want to eradicate maternal deaths and neonatal deaths. And if we are failing as South Africa, we are really digressing. We're going back. We're not making the right steps forward. Because at this stage, I'm not expecting to be having any babies or mothers to be dying due to preventable infections like this.
And this speaks to the finding that says that Gauteng is second to the Eastern Cape when it comes to medical legal claims, paying millions or sometimes billions of rand towards, negligence, instead of using that money for the good of either employing nurses or fixing the infrastructure at hospitals. But let's talk about Tembisa Hospital, Bongani. When you speak to staff there, and as Denosa, when you engage with different stakeholders, this hospital in the past 3 years has come up quite a lot in bad news. What are they saying is really going on there?
Tembisa Hospital is overworked and it's overstressed. If you look at Tembisa Hospital, they need to cater for services for the whole community of Tembisa, Kempton Park, Ivory, Ivory Park, and all those other areas. It's a vast area, and the population in that particular end of the province has grown tremendously. And if you think back to a few years back, we used to have Kempton Park Hospital, which was closed, and there were promises to say that there will be another hospital that will be built, or Kempton Park Hospital should be refurbished or repurposed somehow, and that has not happened. Now, because of the direct result of that particular failure by government, that is why we are seeing all these things that we are seeing at Tembisa. And up until such time that we either extend the wards in Tembisa or we build another hospital in that area to accommodate the growing population of Ekurhuleni, then we're not going to see any changes. These things are going to keep happening, and we're not going to be able to manage them.
Well, Bongani, thank you very much for your time here on eNCA. Quite a sad story. In just 3 years, 800 newborn babies dying at the Tembisa Hospital. Some of what they died from was actually something that was avoidable, but we speak another story today.